What is microscopy, AFB Smear, in TB diagnosis? Imagine trying to find tiny bacteria that cause tuberculosis inside a sample of sputum, which is mucus you cough up from your lungs. That's where microscopy, specifically the Acid-Fast Bacilli or AFB Smear, comes into play. This test is a quick way to look for the bacteria that cause TB, called Mycobacterium tuberculosis, using a microscope. The process involves staining a sputum sample with special dyes that make these bacteria stand out. Because of their unique cell wall, acid-fast bacteria retain the stain even after an acid wash, making them visible under the microscope. This allows health professionals to spot the bacteria directly in the sample. In practice, the test starts with collecting sputum, ideally early in the morning over 3 days in a row. This increases the chances of catching the bacteria if they are present. The sample is then smeared onto a glass slide and stained using techniques like Ziehl-Neelsen or fluorochrome staining. After staining, the slide is examined under a microscope. If acid-fast bacilli are seen, it suggests active TB infection. This method is valued because it is fast, inexpensive, and easy to perform, making it especially useful in places with limited resources. The AFB smear helps identify patients who are likely infectious and need quick treatment and isolation to prevent spreading the disease. It can also be used to monitor how well someone is responding to treatment by checking if the bacteria disappear from the sputum over time. However, it's important to remember that a positive smear shows the presence of acid-fast bacteria but does not confirm TB alone. Other bacteria can sometimes stain positive too, so further tests like culture or molecular testing are needed for confirmation. While the AFB smear is a powerful tool, it does have limitations. It cannot tell if the bacteria are resistant to drugs, so additional testing is necessary to determine the best treatment. Its sensitivity is lower than that of culture or newer molecular tests, meaning it might miss some cases, especially when bacterial loads are low. Because of these limitations, a positive smear should always be followed by more definitive testing to confirm TB and guide treatment. In recent years, molecular tests such as the Xpert MTB RIF assay have become more common. These tests can detect TB DNA and resistance to rifampicin, a key drug, rapidly and accurately. Despite this, the AFB smear remains important, especially in resource-limited settings, because it is simple, fast, and cost-effective. To sum up, microscopy using the AFB smear is a vital initial step in diagnosing active tuberculosis. It involves staining sputum samples and looking for bacteria under a microscope. While it provides quick results and helps identify infectious cases, it must be complemented by other tests for a full diagnosis and to determine drug resistance. Always consult healthcare professionals for proper testing and treatment options tailored to individual needs.